Evidence-based assessment. This chapter basically talks about assessment and its role in the nursing process. It introduces you to the nursing process. There's a lot of definitions in this chapter to help you kind of get started with different types of ways to think about patients and patient data and put that all together. And so it talks about clinical reasoning and clinical judgment. And those are just ways of critically thinking about patient information, putting it together to come up with conclusions and then to act on those conclusions. It talks about setting priorities, different types of databases, some important things to consider when we are assessing a patient, and then the importance of high-level assessment skills, of continuing to maintain and improve your assessment skills. Assessment is a skill that takes practice. So the first definition I want you guys to be aware of is the difference between subjective and objective data. Subjective data is going to be something the patient tells you, something that you can't verify for yourself. An example of subjective data is patient history. We have not been with the patient visually observing everything they've done in the past 24 hours or when their symptoms started. And so we just have to take their word for it. If the patient says, my headache started 3 hours ago, that's subjective data. We just have to assume that the patient is telling us the truth and use that data in treating them. Objective data is information that you can observe. You can feel a lump on the patient, or you can use your stethoscope to listen to heart sounds. Or it could be a number like blood pressure or temperature. And anyone that came into the room and did the same thing you did would most likely get the same results or very similar results. So some examples are physical exam data, something that you saw on the patient or felt or listened to, and then laboratory studies, things like cholesterol. Many times objective data is a number. And then we put those types of data together, the subjective and the objective. We combine that with other things in the patient record that can include things like, are they married or not? What's their address? What church do they attend? As well as lab results and any diagnostic testing results. And we put that all together into a database that has all the information about that patient. This chapter also talks about diagnostic reasoning, and that's just a way to talk about the way that we think about a patient's health data, put it together to draw conclusions, and then to act on that information, to decide what is happening with that patient, and then what action are we going to take. And so it's looking at cues. So a cue might be that a patient is having trouble breathing. You notice that, and then you're going to form a hypothesis. Why is the patient having trouble breathing? You're going to gather some data. Maybe you listen to their lung sounds. Maybe you notice that they're coughing something up. You notice the color and the amount. Maybe that's why they're having trouble breathing. And then you take all the data you've gathered. Maybe we do a chest x-ray. Maybe we draw some labs. Maybe we check their oxygen level. And we see, well, I think maybe the patient has asthma. And then we look at the data we've gathered. Does the chest x-ray support the diagnosis of asthma, or is something else going on? Critical thinking is used often in nursing, and the nursing process is really the big way that critical thinking is introduced in nursing. And these are some examples of kind of some definitions of critical thinking. It's really examining your thinking, really going through and evaluating how are you thinking about a patient situation or a patient problem. Are you able to put the data together in a way that makes sense so you can figure out what's going on with the patient and find a solution? And critical thinking is often used as the difference between someone that's very new in nursing practice, like a student, like yourself, the difference between a novice nurse and an expert nurse. So the nursing process is very important. This is shown in your book. It's figure 1-2, and I would definitely take a look at this. Obviously, this class, health assessment, is going to focus on the assessment portion of the nursing process, but you're going to, in fundamentals, you're going to start using that assessment data, or you're going to put the important things together. You're going to come up with a diagnosis, plan what actions you're going to take to help the patient get better. In the hospital junior year, you will start implementing those actions that you've decided on, those nursing interventions, and then you're going to evaluate the actions that I took to help this patient. Did they make a difference? Is the patient getting better, or is the patient getting worse? And as you evaluate, then it's a circular process. You're going to have to go back and get more assessment data to see where to go from there. So another thing that's important in this chapter is setting priorities, and they have 3 levels of priority: first, second, and third level priorities. And so first level is something that is life-threatening. It's an emergency. When a lot of times in nursing, you'll hear about ABCs, which is airway, breathing, and circulation. Those are the first things we want to check on someone, because we don't care if they have a rash if they're not breathing, or if their airway, if they're choking on something, their airway is blocked, or if their heart's not pumping blood and oxygen and nutrients to the cells. That's an emergency. So those are all first level priorities. Second level priorities, we really want to intervene quickly. They could turn into something life-threatening, and the book lists some examples of those. They're listed here. Mental status changes, if someone is alert when you go in to see them the first time, and then the next time you see them, they're having trouble remembering the month, or who the president is, or they are drowsy. All of a sudden they're hard to wake up. Something is going on that requires prompt intervention. And then third level priorities are things that are important, but we're going to treat them after we've treated all the first and second level priorities. So things like teaching. Someone that is in the midst of an infection, they have a fever, their body's working really hard to fight that infection. That's not the best time to teach them about what's going to happen after discharge. Things like psychosocial issues, we usually leave social work areas, financial issues, issues with family members, divorce, things like that. We're going to leave that until after we've treated the physical issues. And then you should also be aware of collaborative problems, and those are things that are interdisciplinary. So we may have a patient that has a hip fracture and has surgery to repair that fracture, and they may be visited by a variety of health providers, a physical therapist. They might need an occupational therapist after a hip fracture. Maybe a social worker might be involved to figure out if the patient can return to their home, or if they're going to need additional care after they leave the hospital. So interdisciplinary means that it takes more than just nursing, and many problems in the hospital are collaborative and interdisciplinary. So evidence-based assessment or evidence-based practice, that means that we are doing things because research shows that they're worthwhile. There's a lot of practices in nursing that are traditional, that we've done since the beginning because we think they're helpful, but then research comes along and shows that maybe it's not the best practice. And so we really want to have a research or evidence-based practice. Along with research, the clinician's own experience is important in deciding which actions to perform, which interventions, and the patient's preferences. The patient may not, even if you have all the research to support a particular intervention, the patient may not agree with it, or in some cases it might be against their religion. And then also based on your physical examination and your assessment, a certain intervention may not be the best practice for that particular patient. So it's taking the current research, what we know is beneficial to patients, and combining it with the clinician's experience, the patient's preferences, and then the patient's particular situation with their health. So there's 4 types of databases that are collected on patients. A complete or total health database, that's when you first meet someone. Maybe this is the first time they've been to a doctor, and the doctor requires a lot of forms. They want to know all about their family history. They want to know, parents' health history, and it's really the most complete. A hospital admission also, a lot of times, is a complete database. A focused or problem-centered database, that would happen when someone comes in with a particular problem. They have the flu, or they come into an emergency room with a broken arm. Really, the information that's gathered is going to be focused on that problem. A follow-up database is, we know a patient has a particular problem. Maybe they have a chronic illness like diabetes. And so we've already collected lots of information about their complete health, and they're just coming in to be checked on every so often. And so we're just seeing what the status is since the last patient visit. And then an emergency database, this is what would happen in the case of significant trauma or life-threatening illness in the emergency room, where assessment and life-saving measures are performed at the same time. We want to get as much data as we can as quickly as possible while keeping the patient alive. So emergency database, that would be done really in a life-threatening situation in the emergency room. Understand that when we have a patient that is experiencing a health crisis, maybe they're having trouble breathing or they're vomiting, we're really going to focus on that problem first before we get all the other information. Other systems can be assessed once the patient is stable. Okay, and then this chapter also talks about how the concept of health has kind of expanded. We used to think of someone that's healthy is the absence of disease, but now it's kind of moved to a more holistic view of health that includes the whole person, working more to prevent disease instead of waiting until it occurs to treat it, and actually promoting health with things like good nutrition and exercise, in reducing risk of certain chronic diseases like maybe a heart attack or a stroke, instead of treating those diseases, preventing them.